Welcome back, future nurses. In today's video, we're diving into 50 high-yield respiratory system questions for the 2025 NCLEX. These questions are packed with priority actions, safety alerts, and must-know respiratory concepts that show up again and again on the exam. So grab your notebook, stay focused, and let's strengthen your critical thinking skills together. Ready? Let's jump straight into question 1. Question 1. A client with COPD presents with barrel chest and chronic productive cough. Which ABG result is most consistent with chronic CO2 retention? A. pH 7.48, PaCO2 32 mm of mercury. B. pH 7.36, PaCO2 52 mm of mercury. C. pH 7.29, HCO3 20 milliequivalent/L. D. pH 7.50, HCO3 18 milliequivalent/L. Correct answer, B. pH 7.36, PaCO2 52 mm of mercury. Rationale: chronic CO2 retention elevated PaCO2 with near normal pH due to renal compensation. Strategy: COPD equals compensated respiratory acidosis. Question 2. A client with asthma reports wheezing suddenly stops. What is the priority action? A. Reassess lung sounds in 30 minutes. B. Administer oral fluids. C. Prepare for possible intubation. D. Apply warm humidified oxygen. Correct answer, C. Prepare for possible intubation. Rationale: silent chest indicates no air movement impending respiratory arrest. Strategy: asthma, wheezing bad, no wheezing worst. Question 3. Which client should the nurse see first? A. COPD client with SpO2 of 92%. B. Asthma client using accessory muscles. C. Pneumonia client with productive cough. D. Bronchitis client with low-grade fever. Correct answer, B. Asthma client using accessory muscles. Rationale: accessory muscle use equals severe respiratory distress highest priority. Strategy: always see airway/respiratory compromise first. Question 4. A client with pneumonia has increased fremitus. What does this indicate? A. Air trapping. B. Consolidation. C. Pleural effusion. D. Pneumothorax. Correct answer, B. Consolidation. Rationale: fremitus due to sound traveling better through fluid-filled tissue. Strategy: vibration equals fluid/consolidation. Question 5. Which finding indicates the need for immediate intervention in a client with pulmonary embolism? A. Sharp chest pain. B. Anxiety. C. Hemoptysis. D. New onset confusion. Correct answer, D. New onset confusion. Rationale: indicates hypoxia affecting the brain life-threatening. Strategy: P equals sudden hypoxia first sign often restlessness/confusion. Question 6. A client with ARDS is on high PEEP. Which complication is the nurse most concerned about? A. Hypoglycemia. B. Hypovolemia. C. Pneumothorax. D. Bradycardia. Correct answer, C. Pneumothorax. Rationale: high PEEP can rupture alveoli air leaks. Strategy: high-pressure ventilation barotrauma risk. Question 7. Which oxygen delivery device provides the most precise fraction of inspired oxygen? A. Non-rebreather mask. B. Simple mask. C. Nasal cannula. D. Venturi mask. Correct answer, D. Venturi mask. Rationale: delivers exact fraction of inspired oxygen. Rationale: delivers exact fraction of inspired oxygen, ideal for COPD. Strategy: COPD patients equals Venturi equals control oxygen. Question 8. A client post-thoracentesis becomes tachycardic and SOB. What is the priority? A. Place in Trendelenburg. B. Apply pressure to puncture site. C. Assess lung sounds. D. Offer deep breathing exercises. Correct answer, C. Assess lung sounds. Rationale: risk for pneumothorax, must check for absent/bilateral sounds. Strategy, after thoracentesis check for lung collapse first. Question 9. A client with a chest tube has continuous bubbling in the water seal chamber. What does this indicate? A. Normal function. B. Air leak. C. Obstruction. D. Need for suction increase. Correct answer, B. Air leak. Rationale, intermittent bubbling is okay, continuous means leak. Strategy, water seal equals bubbling bad, tidling good. Question 10. Which assessment finding in a client with influenza requires immediate attention? A. Fever of 102 degrees Fahrenheit. B. Body aches. C. Productive green sputum. D. Sudden shortness of breath. Correct answer, D. Sudden shortness of breath. Rationale, may indicate secondary pneumonia or respiratory failure. Strategy, flu plus SOB equals priority. Question 11. A client with tuberculosis is prescribed rifampin. Which teaching is essential? A. Avoid vitamin C. B. Expect orange urine. C. Report mild nausea. D. Avoid dairy. Correct answer, B. Expect orange urine. Rationale, harmless discoloration. Strategy, TB drugs rifampin equals red. Question 12. Which client is the priority? A. Asthma with SpO2 of 93%. B. Pneumonia with fever. C. COPD with clubbing. D. Post-op with stridor. Correct answer, D. Post-op with stridor. Rationale, indicates airway obstruction. Strategy, stridor equals emergency airway. Question 13. A client with epiglottitis presents with drooling. The nurse should A. Use tongue depressor. B. Prepare for intubation. C. Encourage fluids. D. Obtain throat culture. Correct answer, B. Prepare for intubation. Rationale, drooling plus tripod equals airway obstruction risk. Strategy, never use tongue depressor. Question 14. COPD patient with 4 liters per minute NC becomes confused. Cause? A. CO2 narcosis. B. Hypoglycemia. C. Infection. D. Dehydration. Correct answer, A. CO2 narcosis. Rationale, excess O2 lose hypoxic drive CO2 rises. Strategy, COPD O2 goal equals 88 to 92%. Question 15. A client with pneumothorax shows tracheal deviation. This indicates A. Normal recovery. B. Tension pneumothorax. C. Fluid overload. D. Mucus plug. Correct answer, B. Rationale, air under pressure shifts mediastinum. Strategy, deviation equals deadly. Question 16. Best position for a client with COPD during dyspnea episode. A. Supine. B. Semifowler. C. Tripod position. D. Left lateral. Correct answer, C. Rationale, opens thoracic cavity. Strategy, COPD equals tripod. Question 17. A client with pneumonia is prescribed incentive spirometer use. Best instruction. A. Exhale forcefully. B. Inhale slowly. C. Blow into mouthpiece. D. Hold breath 1 second. Correct answer, B. Rationale, promotes lung expansion. Strategy, IS equals slow deep inhale. Question 18. An asthmatic child is restless and agitated. First action? A. Reassure the child. B. Administer albuterol. C. Check temperature. D. Offer fluids. Correct answer, B. Rationale, restlessness equals early hypoxia. Strategy, treat airway first. Question 19. A chest tube disconnects from drainage. First action? A. Clamp tube. B. Call provider. C. Place end in sterile water. D. Reconnect tubing. Correct answer, C. Rationale, creates water seal. Strategy, water prevents air entry. Question 20. Client with pulmonary edema needs which med first? A. Albuterol. B. Furosemide. C. Ibuprofen. D. Codeine. Correct answer, B. Rationale, removes fluid. Strategy, flash edema equals Lasix. Question 21. A pneumonia client's WBC drops suddenly. Concern? A. Viral illness. B. Recovery. C. Sepsis. D. Dehydration. Correct answer, C. Rationale, falling WBC equals septic shock risk. Strategy, infection plus WBC equals worst. Question 22. A client with chronic bronchitis has thick secretions. Which intervention is most effective? A. Limit fluids to 1L/day. B. Increase humidity. C. Use incentive spirometer hourly. D. Encourage deep breathing only. Correct answer, B. Increase humidity. Rationale, humidification loosens and thins mucus for easier clearance. Strategy, thick mucus equals humidified air plus fluids. Question 23. A client receiving suctioning becomes bradycardic. What caused this? A. Oxygen toxicity. B. Vagal stimulation. C. Fluid overload. D. CO2 retention. Correct answer, B. Vagal stimulation. Rationale, deep suctioning stimulates the vagus nerve HR. Strategy, pre-oxygenate and limit suction time. Question 24. Which client requires immediate intervention? A. Asthma client with SpO2 92%. B. Pneumonia client with fever 101 degrees Fahrenheit. C. COPD client with pursed lip breathing. D. Pulmonary embolism client with sudden diaphoresis. Correct answer, D. Rationale, sudden diaphoresis in PE suggests worsening hypoxia. Strategy, PE equals rapid deterioration. Question 25. A client with cystic fibrosis is receiving pancreatic enzymes. Best instruction? A. Take enzymes with water only. B. Take enzymes before or with meals. C. Take enzymes on empty stomach. D. Take enzymes only at bedtime. Correct answer, B. Rationale, must be taken with meals to aid digestion. Strategy, CF equals enzymes with food. Question 26. A client with pleural effusion is scheduled for thoracentesis. Which position is best? A. Prone. B. Side lying. C. Leaning forward over bedside table. D. High Fowlers with legs elevated. Correct answer, C. Rationale, opens intercostal space for fluid removal. Strategy, thoracentesis equals tripod over table. Question 27. A client reports waking up at night choking and gasping. This describes A. Orthopnea. B. Paroxysmal nocturnal dyspnea. C. Apnea. D. Hyperventilation. Correct answer, B. Rationale, PND equals sudden nocturnal breathlessness. Strategy, common in HF plus pulmonary congestion. Question 28. Which finding in emphysema is expected? A. Low residual volume. B. Clubbing. C. Hypocapnia. D. Flattened diaphragm. Correct answer, D. Rationale, hyperinflation flattens the diaphragm. Strategy, emphysema equals air trapped. Question 29. A ventilated client's high-pressure alarm sounds. First action? A. Suction the client. B. Silence the alarm. C. Increase sedation. D. Notify provider. Correct answer, A. Rationale, most common cause equals secretions. Strategy, high pressure equals obstruction. Question 30. A client with SARS has a non-productive cough and worsening SOB. Priority action? A. Assess lung sounds. B. Offer warm fluids. C. Encourage rest. D. Obtain sputum culture. Correct answer, A. Rationale, must detect early respiratory failure. Strategy, SOB equals assess airway first. Question 31. Bronchiolitis in infants is caused primarily by A. RSV. B. Adenovirus. C. Mycoplasma. D. Parainfluenza. Correct answer, A. Rationale, RSV is the leading cause. Strategy, RSV equals contact plus droplet. Question 32. Which assessment finding is most concerning in pneumonia? A. Fever. B. Crackles. C. Tachypnea. D. Cyanosis. Correct answer, D. Rationale, indicates severe hypoxemia. Strategy, oxygenation beats infection symptoms. Question 33. A COPD patient uses pursed lip breathing. Why? A. Helps conserve energy. B. Prevents airway collapse. C. Increases CO2 levels. D. Improves muscle tone. Correct answer, B. Rationale, creates back pressure to keep alveoli open. Strategy, PLB equals exhale slowly through a straw. Question 34. A client with laryngeal cancer is post-laryngectomy. Priority assessment? A. NG tube patency. B. Stoma airway patency. C. Voice quality. D. Incision drainage. Correct answer, B. Rationale, stoma is the only airway. Strategy, laryngectomy equals neck breathing. Question 35. Client with COPD on bronchodilators develops irregular HR. Which medication likely caused it? A. Albuterol. B. Monteliacast. C. Guaifenesin. D. Ipratropium. Correct answer, A. Rationale, beta-2 agonists may cause tachycardia/dysrhythmias. Strategy, albuterol equals fast HR. Question 36. A client with ARDS is restless and confused. First action? A. Reduce noise. B. Increase oxygen delivery. C. Offer reassurance. D. Check blood glucose. Correct answer, B. Rationale, restlessness equals early hypoxia. Strategy, treat O2 before comfort. Question 37. A client is receiving theophylline. Which symptom indicates toxicity? A. Tremors. B. Constipation. C. Sleepiness. D. Weight gain. Correct answer, A. Rationale, early signs, tremors, tachycardia. Strategy, theophylline equals narrow therapeutic range. Question 38. Which finding in pulmonary fibrosis is expected? A. Increased lung compliance. B. Decreased breath sounds. C. Chronic productive cough. D. Rapid shallow breathing. Correct answer, D. Rationale, stiff lungs rapid shallow breathing. Strategy, PF equals hard lungs. Question 39. A client with hemothorax has absent breath sounds on one side. This indicates A. Air trapping. B. Lung collapse. C. Upper airway obstruction. D. Hyperinflation. Correct answer, B. Rationale, blood compresses lung collapse. Strategy, absent sounds equals collapse or blockage. Question 40. A COPD client has polycythemia. Why? A. Increased WBC production. B. Chronic hypoxia. C. Fluid loss. D. Hormone imbalance. Correct answer, B. Rationale, hypoxia stimulates erythropoietin RBCs. Strategy, COPD equals more RBCs to carry oxygen. Question 41. A client with chronic respiratory failure has morning headaches. Cause? A. Hyperventilation. B. Hypercapnia. C. Dehydration. D. Hypoglycemia. Correct answer, B. Rationale, CO2 rises overnight headache. Strategy, high CO2 equals headache plus somnolence. Question 42. Which condition requires airborne precautions? A. Influenza. B. RSV. C. COVID-19. D. Tuberculosis. Correct answer, D. Rationale, TB spreads via airborne droplet nuclei. Strategy, TB equals N95 plus negative pressure. Question 43. A client is choking but still able to make sounds. What should the nurse do? A. Begin chest thrusts. B. Perform abdominal thrusts. C. Encourage forceful coughing. D. Call a code blue. Correct answer, C. Rationale, partial obstruction cough to clear. Strategy, if they can talk encourage cough. Question 44. A client with pneumonia has pleuritic chest pain. Best intervention? A. Encourage slow breathing. B. Splint chest during coughing. C. Decrease fluid intake. D. Avoid analgesics. Correct answer, B. Rationale, splinting reduces pain during deep breaths. Strategy, pain control helps ventilation. Question 45. A client receiving high-flow O2 develops nasal dryness. Best nursing action? A. Reduce oxygen flow. B. Add humidification. C. Switch to Venturi mask. D. Remove oxygen intermittently. Correct answer, B. Rationale, humidification prevents mucosal dryness. Strategy, any high-flow O2 equals add moisture. Question 46. Attention pneumothorax causes. A. Increased venous return. B. Hypotension. C. Bradycardia. D. Lung overperfusion. Correct answer, B. Rationale, intrathoracic pressure compresses heart CO hypotension. Strategy, tension pneumo equals air plus pressure plus shock. Question 47. A client with asthma is prescribed a corticosteroid inhaler. Key teaching? A. Take with a bronchodilator. B. Rinse mouth after use. C. Use only during attacks. D. Drink milk afterward. Correct answer, B. Rationale, prevents oral thrush. Strategy, steroids equals rinse mouth. Question 48. A client with COPD is eating. Best instruction? A. Eat large meals. B. Drink fluids with meals. C. Use bronchodilator before meals. D. Lie down after meals. Correct answer, C. Rationale, improves airflow for eating. Strategy, small meals plus bronchodilator first. Question 49. A client receiving chest physiotherapy should be placed. A. Supine. B. In positions promoting drainage. C. Prone with pillow under chest. D. Sitting upright only. Correct answer, B. Rationale, postural drainage uses gravity to mobilize mucus. Strategy, CPT equals drain the lung segments. Question 50. A client with severe asthma is receiving magnesium sulfate. What is the expected effect? A. Bronchodilation. B. Increased secretions. C. Vasoconstriction. D. Tachypnea. Correct answer, A. Rationale, magnesium relaxes smooth muscles bronchodilation. Strategy, used for status asthmaticus. Great job making it through all 50 respiratory system questions. Remember, consistent practice is the key to NCLEX success. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell so you never miss another high-yield review. Drop a comment with the next topic you'd like to see, cardiac, endocrine, priority questions, anything you need, I've got you. Until next time, keep studying, stay confident, and I'll see you in the next video. You've got this, future RN.